Naša ďalšia téma bude inovatívna liečba. Budeme sa rozprávať o tom, ako vlastne vieme zabezpečiť pre slovenského pacienta prístup k inováciám, kde niektoré z nich sú v niektorých krajinách štandardom a v niektorých vôbec. Ešte predtým vás poprosím, aby ste sa opäť zapojili do našej ankety. Máme pre vás pripravenú otázku, že či prístup pacienta na Slovensku k inovatívnym liekom je oveľa horší, teda to je fakt, a či by malo Slovensko navýšiť investície do inovatívnej liečby. To je otázka pre vás a opäť opakujem, že sa môžete zapojiť aj vašimi otázkami do našich diskusí. Budeme zvedaví na to, čo sa budete chcieť pýtať našich hostí vy. A ja by som teraz rada pozvala na pódium Jasper Kunow, Managing Director, CEO of Merck, Sharp and Dohme. Jasper, hi, welcome.
Give me a minute. Good
Nice
morning.
to meet you.
Good to see you. Good morning. Thanks for having me.
So, let's start with COVID. How COVID affected the cancer treatment?
Yeah, well, I mean, as you heard Friederike was saying, I mean, the collateral damage was quite substantial, right? I mean, there's people talking about the second pandemic already, as in the cancer pandemic. And the reason for that is, well, multifaceted, basically. We've seen the incidence of cancer going up by about 50% over the last 10 years in Europe. And the root cause for that is pretty much the aging population, but then also technology kicking in, allowing us to drive early cancer detection, right? At the same time with COVID-19, we've seen now, well, the damage being done as in patients missing out on diagnosis entirely and are being diagnosed at a later time point. And what this means is that these patients would then move on to late-stage disease and probably, well, miss out on curative treatment, unfortunately. And hence, due to this backlog of patients, I mean, healthcare systems have been struggling to quite some extent to provide adequate care to these patients. So incidence, well, has gone up, and there's more patients now missing out on treatment. We saw that impacting mortality rates also, right? Mortality rate has increased in Europe also by about 20% over the last 10 years. But now due to COVID hitting, in some countries we do have really good data, right? Real-world evidence suggesting and showing, for instance in the UK, unfortunately, that well, there's more patients dying from the disease. The reason being late diagnosis and or, well, the fact that they were unable to obtain access to adequate diagnosis, adequate treatment, adequate rehab and palliative care, unfortunately. So yeah, I think we need to drive innovation in this space and build resilient healthcare systems moving forward to properly deal with this big issue.
Yeah, horrible topic. How the scientific progress has transformed the cancer treatment, and what does it mean for the patients and the economy of the countries?
Well, let's start talking about the medical or the clinical impact and the impact on patients to start with, right? I mean, we've been discussing now, well, the issue coming at us related to incidence going up, mortality going up. Now, I already mentioned that incidence has gone up by 50%, mortality by only 20%. And as you can see, well, mortality is on the rise, but to a smaller extent compared to cancer incidence. And what this tells us is that, well, early intervention, early diagnosis, prevention, all of these measures we've been mentioning already did have an impact on mortality to a great extent. And with innovation going on in the space, of course, we expect further improvements to kick in the future. Now, there's been a lot of innovation going on in the space lately, right? We've seen so many new cancer treatments being introduced, obtaining EMA approval, and ultimately, well, being made accessible to patients also across markets in Europe. And fortunately, we've been at the forefront here of driving R&D in this space and bringing new medicines to market also. In the past, in cancer care, we were talking like, well, surgery, radiotherapy, chemotherapy to a great extent. Now we're talking personalized healthcare. On top of that, immuno-oncology agents being introduced. And these new interventions, new modalities have been turning cancer more into a chronic disease, as in, well, now we are talking, about how to enable patients to live with cancer rather than die from cancer. And you can see that actually, I mean, the 5-year survival rates have gone up dramatically over the last years across a wide array of cancer types. In breast cancer, we are now talking 95% a 5-year survival rate. In prostate cancer, same level. Well, there's more to be done, right? There's 4 big cancers. I mentioned the 2 of them already, breast and prostate, but there's colorectal and then lung cancer to be addressed to a great extent. And hopefully we'll be able then to push up survival rates as well. I mean, with immuno-oncology drugs, basically, even in late-stage disease, we are now talking long-term survivorship. And that's a game changer. That's a true game changer. In lung cancer, for instance, like 5 years back with chemotherapy in the late-stage setting, the 5-year survival rate was about 8% only. And now with immuno-oncology drugs, we were able to push it up to close to 30%. So it's a tripling of survival outcomes and patient outcomes, and more to be done, but we've seen that improvement happening. Now, unfortunately, in Slovakia, I wanted to make that point, we haven't seen these new, innovative, and groundbreaking innovations making inroads into the public health landscape, unfortunately. So there's a lack of access here, hindering patients from benefiting from
aby benefitovali z týchto nových modalít. Úmrtnosť na rakovinu je bohužiaľ oveľa vyššia. Priemerná dĺžka dožitia na Slovensku je zhruba o 5 rokov kratšia a to je samozrejme aj dôvodom, samozrejme tie dôvody sú oveľa širšie, ale nedostatočný prístup k týmto typom liečby je tiež jedným z dôvodov. Takže skorá diagnostika je kľúčová v tomto smere a v diagnostike na Slovensku tiež nie sme asi veľmi dobrí. Je to prvá vec, na ktorú by sme sa mali v prvom rade zamerať, diagnostika? No, ja som vzdelaním vedec, hej. A aj keď pracujem teda v súkromnom, v komerčnom sektore istý čas, domnievam sa, že niekde hlboko vzadu som stále ešte vedec a snažím sa identifikovať problémy a hľadať riešenia pomocou vedeckého prístupu. A to, čo sa snažíme aj my v odvetví, je nielen teda vyvíjať nové lieky a nové inovácie pri našich pacientov, ale v konečnom dôsledku zabezpečiť, aby viac pacientov malo prístup nielen k liečbe, ale aj k primárnej prevencii, aby sme s tým treba začať, hej, a potom aj screening, dôkladná správna diagnostika, ktorá samozrejme zvýši detekciu rakoviny, no a samozrejme v konečnom dôsledku aj z komerčných a iných dôvodov iste aj k vývinu liekov alebo liečby, ktorým budú mať pacienti prístup, aby mohli aj oni benefitovať z týchto inovácií. Takže je to celá škála prístupov. Začína to s budovaním infraštruktúry, samozrejme zapojením zdravotníckeho personálu, ktorý by dokázal manažovať týchto pacientov a tak ďalej a tak ďalej. Budovanie kapacít, budovanie schopností, ktoré umožnia, aby cesta pacienta systémom bola hladká a efektívna a samozrejme dôkladná diagnostika. A čo sa týka patologického frontu, možno budeme hovoriť o patológii za niekoľko minút, kde budeme hovoriť o identifikácii biomarkerov, ktoré umožňujú diagnostiku rakoviny alebo iných ochorení. A v konečnom dôsledku, áno, potom musíme umožniť pacientom, aby mali prístup k modernej, inovatívnej liečbe a aby táto liečba bola preplácaná samozrejme zdravotnými poisťovňami.
Jasper, please stay on the stage. We will continue with the
Jasper, ďakujem veľmi pekne. Budeme pokračovať v panelovej diskusii.
Thank you very much.
Ďakujeme veľmi pekne.